My name is Dr. Rotimi Johnson. I'm a vascular and interventional radiologist of RJ Medical Group. Today I'll be talking about a new procedure called prostate artery embolization. Prostate artery embolization is a newly approved procedure for the treatment of large prostates that causes BPH symptoms. It is a minimally invasive procedure. It is a day surgery case. Patients are discharged home on the same day. There's no cutting or bleeding involved with this procedure. Present to me either when they read about this procedure on the internet, or they can be referred by their primary care doctor to see me when they have failed other treatments such as medication treatments. These patients may have been taking sulfalmito. Some of them have been taking alpha blockers like tamoxifen. Some have been taking 5-alpha reductase inhibitors such as finasteride, and their symptoms are still present. These patients are being on long-term catheters, and they have catheters for years, and these catheters causes urinary tract infections, and sometimes it's so bad that they have to go to the intensive care unit to be treated for the infection. The investigations that I do when I see these patients in clinic is first to get a history from them. I find out if they have any other medical problems, what allergies they might have. I do a physical exam on them, including a digital rectal exam. And this digital exam involves using the index finger to look for any evidence of prostate cancer. There are some lab evaluations such as urinalysis to look for any urinary tract infection or diabetes. I order a PSA test to have a baseline PSA level. I do a Euroflow exam, order CBC, BMP to look for the kidney function, and also order a CT scan. Patients who I'm going to treat, I have them complete a form to score their, it's called an IPSS form, and which measures their symptoms severity and their quality of life. And I also ask them to fill out an erectile index form. Prostate artery embolization has been approved by the Food and Drug Administration in the US as far back as 2018. It has also been approved by the European Union and also the National Institute for Healthcare Excellence in the United Kingdom. In 2008, two investigators, Dr. Canavel from Brazil and Dr. Pisco from Portugal, started investigating the effectiveness of this treatment for BPH symptoms. And what they found out was that this prostate artery procedure was as effective as doing surgery. And they also found out that it was very safe and effective in about 90% of patients. A lot of questions that I get is if this prostate artery embolization procedure is used for prostate cancer. And the answer to that question is that it is still experimental. It's not approved for the treatment of prostate cancer. There are many studies though that are very encouraging because we know that prostate cancer can be very vascular, and you know, if you cut off the blood supply to it, that might devitalize the cancer, but it's not yet approved. There's still an area for a lot of research. I do know that in the liver and in the kidneys, we do chemoembolizations, and we're able to get very good results. The doctors who perform prostate artery embolization are vascular and interventional radiologists like myself. These people are specialists in targeting and in guidance and in imaging. The day of a PAE procedure, the patients come into the holding area, they get an IV placed, do another physical exam and an assessment. They are transported to the angiography suite. Once they are there, they are placed under conscious sedation under my direct supervision. They get IV fluids, antibiotics, they get oxygen. The left wrist is prepped and draped in sterile fashion. 1% lidocaine is injected into the skin for anesthesia. Under alternate guidance, I gain access into the radial artery in the wrist, then advance wires and catheters under fluoroscopic, which is a live X-ray guidance, to the prostate artery. Once I'm in the prostate artery, I inject some dye and I see the enlarged prostate. And the next step is to mix up the beads, inject these tiny beads into the prostate artery to block off the flow to the prostate artery. Move the catheters and apply pressure to the radial artery for about 10 minutes. Then the patients are then discharged home after 2 hours. Not that much pain involved with prostate artery embolization, but I give some anti-inflammatory, and typically if there's any mild pain involved, it's typically resolved in about 3 days. All patients get antibiotics to go home with because some of these patients may have infection in their prostate. These patients I will see in clinic in about 2 weeks after the procedure. At that time, the urine flow should have been established. So for patients who have catheters, this is a good time for me to attempt removal of the catheters. For patients who I do this procedure for in the hospital, maybe for bloody urine, typically these patients will have improvement of their symptoms and stoppage of the bloody urine in 24 hours. About 12 months and at 2 years, the urine flow is as effective as patients who have surgery. The benefit of prostate artery embolization is that it is same day. There's no bleeding involved. There's no blood transfusion. You don't have to worry about leaking urine because it's not surgery. The sexual function is preserved because you're not removing the ejaculatory ducts. In fact, a lot of patients have stated that their sexual function is improved because the ejaculatory duct is not being compressed, okay, and the prostate is actually smaller. Prostate artery embolization is very effective treatment and is recommended for patients who are seeking a minimally invasive procedure for the treatment of large or very large prostates. It is a treatment that essentially shrinks the prostate, and there is no pressure on the ureter or the ejaculatory duct, and urination and ejaculation are both improved. It's as effective as TURP or prostatectomy at 12 months and 2 years. All patients who have very large prostates should be considered for prostate artery embolization as a first line. Thank you for watching. Be sure to subscribe to this channel and to check out my website at rjmedicalgroup.com.